Here in the U.S., it's National Suicide Prevention Week. It's an annual campaign that works to share resources and stories while promoting suicide prevention awareness. According to the World Health Organization, more than 700,000 people take their own lives every year. That amounts to one person every 40 seconds. Suicide prevention remains a top priority for the Department of Veteran Affairs. According to the VA's 2021 Suicide Prevention Report, suicides among veterans decreased by 7% in 2019. Dr. Aron Tendler joins us now. He is the Chief Medical Officer of BrainsWay, a company that works in advanced, non-invasive neurostimulation treatments for mental health disorders. Doctor, thanks for being with us. We're in an unusual time amid the pandemic. Give us a sense about the toll that this pandemic has taken on our mental health.
The pandemic has increased the incidence and the prevalence of anxiety and depression. So there are more people who are at risk for suicide. It's also increased the amount of people who are struggling with OCD and that aren't necessarily sure whether their fears of contamination or their fears of going out into public are normal or abnormal, and there are more people who are isolated. There are more people who are alone and not getting the support that they need. And as most of you know, there's been a 30% increase in overdoses from last year. So there are many, many more people who are feeling hopeless and alone and are struggling without the resources of getting help. And there are some more people who have financial insecurity, which is also a big deal for people. So as you mentioned, suicide is a very real problem. Suicide really occurs when people have an absence of hope. They don't see another alternative. You know, many people don't realize that mental health is not as stigmatized as it used to be. They don't realize that these problems are brain disorders, just like hypertension, just like stroke, just like heart disease. They're just, physical illnesses. And that's primarily what we do at BrainsWay, which is we try to look at illnesses as brain diseases and treat them with neurostimulation technologies. For suicide, it's very important to, look out for the signs of suicide. So if you see someone isolating or appearing depressed or sad or anxious, and if they're increasing in their substance use, you should, approach them with love and concern and ask them direct questions. Specifically, are you wishing you were dead? Do you think about not being present anymore, not being alive? And then, asking them if they've been thinking about methods of taking their own lives. And if they say they're thinking about methods of taking their own lives, you ask them if they're actually making any plans or if they have any intentions of following through on those plans. And if someone has done that or is making plans to do that, and if they've taken any such steps, they're considered a high risk. Excuse me?
I think I just want to sort of reinforce what you just said there about depression and thoughts of suicide being a brain disease. I think often people think of it as a personal failing, and that is embarrassing to them. And so they don't get treatment like they would for any other illness. You got the flu, you take medication. So I'm really glad that you kind of underlined that. And, talking about the pandemic is one thing, but just because we're marking the 20th year since 9/11, I also want to bring up some, there are some staggering statistics out there of former military who have committed suicide. And they struggle for years because of the stigma. So I want to talk about what the company that you work for does. I presume that by the time people are coming to BrainsWay, it's because they've already tried more traditional methods. They've already tried medication or meditation or whatever it is, and they're looking for a different type of treatment. Can you tell me what the treatment does and how successful it has been?
Yes. So the treatment, instead of changing trying to increase the amount of some of the chemicals in the brain that go through the whole body, which are neurotransmitters. This treatment directly acts on the neurons. It uses magnetic pulses, just like an MRI, and it stimulates the neurons that are underneath the magnet. So it directly increases the activities of the neurons that are those neurons that are not acting the way they normally would. So if you think of depression as an area in the brain which is underactive, it increases the activity of those neurons underneath the magnet. And when the person comes in every day for 20 minutes, sits in the chair for 20 minutes a day, and for those 20 minutes, we're making that area in the brain active. And the person comes in generally for 36 sessions. That's what insurance covers. Every insurance covers it in people who've tried medications and either had side effects like weight gain or sexual side effects, or the medications didn't work, which is typically what happens in these people, because in about a third of people, medications don't work. So those patients come in, they come in for 20 minutes a day, and about 75% of those people will have a response to their depression by the end of the treatment. This is after having failed 4 or more medications. And similarly with obsessive compulsive disorder, we have similar results. That's how the treatment works.
Veterans often suffer from PTSD, which can potentially impact their entire lives after returning from active duty. Does your company have experience working with U.S. service members dealing with mental health issues?
We do have experience with PTSD. This treatment is not indicated specifically for PTSD or for suicide specifically. It's indicated specifically for depression, for OCD, and for smoking cessation. There are different devices for each. And what happens with PTSD is that patients who have PTSD typically are also depressed with the PTSD. So PTSD is a disease which has several components. As you know, it's a disease which is based on people having been exposed to a trauma in a life-threatening situation, and then there are intrusive recollections and avoidance based on that trauma, and negative cognitions. When I say negative cognitions, I mean a significant pessimism about the future, like nothing's going to work out, and so on and so forth. And many of those people also have either moderate or severe depression with it. With the symptoms of depression are, tearfulness, lack of pleasure, isolation, guilt, thoughts of death, and so on. So this treatment that we have approved treats the depression and will give people hope, and so on and so forth. And you can combine the treatment with exposure therapy, which is one of the treatments that's very effective for PTSD. I hope that clears that up.
Yeah, that does. I want to ask, earlier in this conversation, you talked about how you should approach loved ones who you think may be depressed, may be thinking about suicide. I want to kind of go back to that because I think that it is a challenge when you're on the outside looking at someone who seems to be spiraling, but they don't want to talk about it, or when you ask them how things are going, they say, oh, it's okay. And so sometimes it's difficult to sort of reach in and pull them out. Do you have any other advice if you know someone that you think, their mood is off, it's been going on for a while now, it's not just, they're a little down, it's something more than that. Do you have any advice in terms of how to approach that person to convince them to get help, to convince them that this is not a weakness of their own, that it could be a chemical imbalance or something else?
Well, first of all, it's important to recognize, just looking around, how common these diseases that we're talking about. So, you're talking about 1 in 4 people probably have suicidal thoughts, and across their lifetime, 1 in 4 people have depression across their lifetime. And if you meet a person that you think is not doing well, and you think they're depressed, and you think they're struggling with seeking help, if you just look around in your own family or your own friends and celebrities, I mean, we just got such a tremendous amount of open support for our really incredible Olympic athletes who were able to openly express that they were struggling with some, depression or stress, and you let people know that, there are treatments for this. This is perfectly normal. This is something that you can get treatment for, and you can get back to being even better than you were before. And if you just share those thoughts with the person who, when they're depressed, they kind of have those depression sunglasses on. So everything they see, their past, their present, and their future, it's all dark. But if you just have that conversation with them, that what they're thinking is not really their normal thought process, it's the depression that's altering their cognitions. It's not really the truth. The truth is what they would be seeing if they just took those sunglasses off. Then you can get them to get some help. And if you really are concerned, either you can call with them and wait with them and call for help. You can call 1-800-273-TALK, or you can wait with them and call 911. And people really do get better. And there really is an approach now that's different, where you really can treat people both pharmacologically, with therapy, with non-invasive treatments like deep TMS, but you also treat the actual suicidality. You're not just treating the illnesses, you're also treating the suicidal thinking. And what I mean by that is you both remove the means. Like, let's say someone's suicidal, you remove guns, or if someone has a specific way that they want to kill themselves, you discuss safety planning with them. Like, you say, okay, let's discuss what we're going to do now. When you're thinking in the suicidal way, maybe you're going to come over to my house, or you're going to go over to this family's house, meaning you discuss a practical way. Oh, this is something that you enjoy, so when you get suicidal, why don't we do this? So there is actually an approach, and it's been actually proven to work over the last 20 years. It's not just a theoretical approach. It's actually been proven to work and reduce suicide, to 1/4 to 1/10 of what it was before with these, suicide reduction methods. They're evidence-based.
Such important information. Dr. Aron Tendler, thank you so much for being with us. We appreciate it.
Thank you for having me.
And as Dr. Tendler said, if you or someone you know needs help, the National Suicide Prevention Lifeline Network is available 24 hours a day, 7 days a week. You can call their hotline at 1-800-273-TALK. You can also find them at suicidepreventionlifeline.org.